topic of discussion today is racism as a public health issue. The learning objectives I hope to complete after this recording are to demonstrate an understanding of the impact racism has on public health, to identify and differentiate between health equality and health equity, and to recognize implicit racial biases rampant in today's society. So to go right in, the concepts we're going to be talking about today are obviously race, racism, equality, equity, and the concept of unconscious racial biases. So as stated by the APHA president, Gamera Jones, she said that racism is a system of structuring opportunities and assigning values based on the social interpretation of how one looks, which is what we call race. That unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strengths of the whole society through the waste of human resources. So I think this is really telling of today's society and culture, that racism is very much still alive and thriving. And I think it's a conversation that most of us have not had the chance to have as a growing culture. So two of the concepts I said we were going to be talking about were race and racism. And to be clear, these are not the same thing. There is no genetic basis for race. It's simply used as a powerful social construction. And it's really just used to establish privilege and power dynamics among people of a culture and of different cultures, obviously. And race really inhibits the access to resources and opportunities within different cities, countries, nations across the world. Racism, however, is that idea of prejudice plus power. It's a discrimination based on one's race, so the social construct of race plays a huge part within racism. And it's a belief that one's race is superior to another, and it's based in beliefs, policies, attitudes, and actions. So that means that, as seen on a couple of the other slides, that racism can be internalized and it can also be part of a larger infrastructure picture. So like I just said, there are different forms of racism based in beliefs, policies, attitudes, stuff like that. So the first form of racism is the individual or internalized racism, and that's a racism that exists within individuals. It's where a person can hold a negative opinion about themselves or idea about their own culture. And a lot of the time this happens unknowingly or even unsuspectingly because of the culture and society that we've all grown up in, and how you as a person of a certain race or ethnicity have certain values and views of your own culture. The idea of interpersonal racism, though, is that racism that occurs between individuals, and this is probably one that we are most familiar with as this culture. It's just when one person or group of people holds a negative attitude towards a different race or culture, and this can be really detrimental, especially to young children who grow up in this culture and essentially learn this type of racism. The next type is institutional racism, which is not individualist, and it's not necessarily intentional either. So, and it's when institutional and cultural practices perpetuate racial inequality. And an example of this is the Jim Crow laws. So these are things like policies and practices in government that don't necessarily benefit all races. They were written or proposed in a sense that would help all people, but doesn't necessarily, because those different cultures and races were not taken into consideration. And the last form is structural racism, and this is racism in which interinstitutional interactions produce racialized outcomes even without racist intent. So the way I think about this one is the different systems that we hold in a large city or a nation. So this is the interaction of the education system, of the justice system, and how those all play a part in one's success or failure. And again, this doesn't have to be with racist intent. It's just how society and cultures have been molded over the years, unfortunately. So I took this quote from the New York City Department of Health and Mental Hygiene Commissioner, Mary Travis Bassett. If we fail to explicitly talk about racism and health, especially at this time of public dialogue about race relations in this country, we may unintentionally bolster the status quo and enable the perpetuation of health inequities, even as society is calling for change. I think this quote is really telling about today's times, especially in America, where we're having these conversations about police brutality and the failed education system in some parts of the country, or even across the city, how the education system can be completely different for one neighborhood versus another. So yeah, I thought that was really interesting how even as society is calling for change, even though we are protesting and we are talking about how these things are not right, the perpetuation of health inequities is still very prevalent in today's society. So to talk about racism and health, the racial and ethnic minorities are more likely to have unequal access, receive poorer quality care, and have worse health outcomes. And that just means that with that because of this unequal access, the health outcomes and quality of care tend to be a little bit worse than others. And continuing on that, the average life expectancy of Black Americans is 5.5 years less than white Americans, and that evens out to be about 77.9 years of life versus 72.4 years of life, which in the large scheme of things doesn't seem like a whole big of difference, but there's still that inequity. The risk of low birth weight for Black Americans is 1.9 times higher than white Americans. And at a time that we're talking a lot about maternal and child health, it's really interesting to think about how the quality of a hospital or the quality of the prenatal care or even the education before the prenatal care could be completely different for a Black American versus a white American. And again, that goes into the disproportionate number of white physicians that practice in areas of primarily minority populations. So we have these doctors, and there's not a lot of them that practice in these minority populations, which is really upsetting. There's another quote that minorities are more likely to require healthcare services, but they're actually less likely to receive them. And I think this plays into the part of the number of white physicians that do not practice in areas of primarily minority populations. But that could also play into the part that maybe we don't have enough minority doctors. The additional concepts that I wanted to touch on were medical redlining, excessive wait times, unequal access to emergency care, and the last one is the deposit requirements as a prerequisite to care. In some of these quick clinics, a deposit requirement can really hinder the amount or quality of care that a person is to receive. So I know we talked about equality and equity a little bit before, but I wanted to provide a figure that could better show it. So equality, as you can see, everybody gets the same thing, but that doesn't necessarily help every individual. So in this depiction, it's kind of silly, but there are three individuals of different heights, and they are all trying to reach an apple, which is on the same height, obviously. And they're all given a crate or a box, whatever you want to call it, to stand on to help them reach that apple. However, giving the same size crate to a person who is double the size of the shorter individual only helps one of the depicted figures. On the equity side, though, we have those same three individuals, the same apples, on the same height, and we give them the crates that will help them attain those goals or reach those apples, so to speak. The person who had the longest way to go got the most amount of help. And the person who was almost there just got a little bit of help. And I know some people might perceive this as unfair or unjustified, but I think those people aren't aware of the history and the oppression that some people have gone through and others have not, which may hinder their opportunities or successes in life. So to go off of that, equality again is everyone gets the same thing, and it can only work if everyone starts from the same place and needs the same things. So that's something I didn't say in the figure, is that not everyone is starting from the same place, and not everybody needs the same things. Different populations, different cultures thrive on different necessities or different cultural practices, or they have different medical conditions. Equity, though, however, is rooted in social justice, which is really big right now in the public health world, which is providing this health equity to people of all cultures and races. And it's achieving the highest level of health regardless of differences in social, economic, or environmental differences. So, regardless of your social, economic, or environmental differences, health equity is thriving to help you achieve the highest level of health regardless of that. So to touch on the social determinants of health, the WHO, the World Health Organization, stated that the social determinants of health are the circumstances in which people are born, grow up, live, work, and age, and the systems put in place to deal with illnesses. These circumstances are in turn shaped by a wider set of forces, which are economics, social policies, and politics. The CDC, the Center for Disease Control, states that only 25% of your overall health is likely affected by an individual's genetics or biology, and their personal behaviors such as alcohol and tobacco use or exercise. That means that 75% of a person's overall determinants of health are beyond their personal involvement and instead are part of the society they live in. The social determinants of health are extremely important when talking about equality and equity, simply because of the social constructs that they deal with. So they deal with economics and environmentals and someone's housing or the social policies that surround the community that they live in and the politics that shape those policies. So like the CDC said, only 25% of your overall health is likely affected by an individual's genetics or biology. But it's much more important to focus on behaviors such as alcohol and tobacco use and exercise, which can then be, those can then be influenced by someone's environment or the education system that surrounds their community or the economics that surround their community as well. I hope I explained that correctly, and I hope that makes sense to everybody, that it's not just your genetics or your biology that you are born with, but it's also the behaviors that are shaped by your environment that determine your health, essentially. So to talk about the implicit racial bias, which is an attitude or stereotype that affect our understanding, actions, and decisions in an unconscious manner. So implicit racial biases are activated involuntarily and without an individual's awareness or intentional control. And I think it's important to understand that all of us have implicit racial biases. The example that I like to use, especially for white women, is if you were walking down a street that was not very well lit and you saw a white man walking your way, wearing, I don't know, a hoodie or jeans and a hoodie, let's say, and they were walking your way, you would be less likely to either change the side of street that you were walking on or be skeptical of this individual if they were white rather than if they were black. So these implicit racial biases reside deep within our subconscious, and they are based on characteristics such as race, ethnicity, age, and appearance. So that's why I said the individual walking towards you is wearing a hoodie, because I think that's one of the triggers that a lot of people have, especially with recent events and people being shot based on the type of clothing that they were wearing. However, these implicit racial biases are malleable and can be potentially unlearned. So that just means that there is some hope that these racial biases that we hold inside of ourselves, if we become conscious of them and we become aware of these, that we can potentially unlearn these. And these racial biases are not only interpersonal, but they are also institutional and structural. Because like I said on that other slide with the forms of racism, some of these types of racism are completely unintentional. They're just the way that culture and society has been conditioned to think. So an example of racism as a public health issue in America is the Flint, Michigan case. This case highlighted lead-tainted waters that were essentially forced upon a population that was predominantly African American because of the economic state that that city was in. The water was changed from the Detroit water source, which was Lake Erie, and was switched to the Flint River, which had high levels of lead, and the pipes that were bringing the water to people's homes, and actually the GE plant as well. I'm sorry, the General Motors plant. Were old, so that was leading to more issues. So the lead-tainted water stifles early childhood development, and some examples of this development are learning difficulties, lower IQ, slower growth and anemia, hyperactivity, and also difficulty paying attention. So lead can be particularly detrimental to children because of these early childhood development issues that it causes. And because this population was primarily African American, the issues that lead causes, such as hyperactivity, difficult paying attention. I think aggression is also an issue with lead poisoning or lead exposure, at least. That this population would be set back for generations to come. So in the quote below, it says, if you were going to put something in a population to keep them down for generations to come, it would be lead. And that's not to say that there aren't other things that could potentially put this population down, but the lead definitely will hinder the success of these children. And I actually heard somebody say the other day that this whole generation is going to be lost, which I just thought was heartbreaking and absolutely awful. This problem is larger than Flint, though, and stems across the entire country. In Washington, D.C., levels of lead in the Stadium Armory neighborhood were found to be 10 times the accepted level of the standard. And it's hard to say if that problem has been since solved, which is also something that we all need to keep in consideration and to think about. In New York, the New York City Housing Authority buildings hold excessive amounts of moisture, which have resulted in severe problems with toxic mold, which causes asthma, as well as other health problems. And there are about 400,000 city residents living in these housing authority buildings, which are generally a mostly minority population again. So this minority population is being unfairly treated. In Baltimore, the percentage of black households with dangerous levels of lead has increased, but on the contrary, the percentage of white households with dangerous amount of lead has decreased. So I think that speaks to the importance and potentially how much government pays attention to different populations and different communities with similar issues, like this issue of the dangerous levels of lead. Some of the answers, I know this is not obviously a comprehensive or exhaustive list, so I hope this recording helps you think about more solutions and answers than just these. However, the solution is more than just funding. We can't just throw money at these populations and expect them to be able to fix this problem themselves. When society has created these issues, throwing money and funding is not going to solve anything. We need to have a more integrated and holistic thinking about this issue as a greater whole, I guess. We need to remember that all systems have a part in this, and that by only addressing one of them, there are still going to be things that fall through the cracks. We need to address the social, environmental, and educational dimensions of racial inequities. So again, that's this idea of this holistic thinking. If we just address the social issues of racial inequities, the environmental and education dimensions will still pull people down. And in doing so, we need to elevate social justice, which is, again, this idea that justice is in the terms of distribution of wealth, opportunities, and privileges within a society. And a nice little quote that I found the other day, I think it was, that individuality gives way to the struggle for social justice. So I think we need to remember to not just focus on individual behaviors, but this social construct as a whole. Some additional readings that I would highly recommend are The End of Racism, Colorblind Racism and Popular Media in Post-Civil Rights America. This touches on the idea that when people say that they don't see color, that actually is a form of racism called colorblind racism. Discrimination and health inequities talks about exactly what I just talked about, health inequities and how the different constructs, such as the social, environmental, and educational dimensions, play a huge part in that. And the last one is the association between racial discrimination and hypertension is moderated by implicit racial bias, which is a study of midlife African American men. This was actually incredibly interesting because it talks about not only healthcare inequities, but it also touches on the implicit racial bias of African American men in today's culture. These are just some additional resources with some great information on this topic. I hope you guys enjoyed today's lecture. Thank you.